When we think about work-life balance as a doctor, it's easy to get lost in the rather fluffy stuff of, organizing your private life and your work as a doctor. A little known side effect of digital brand positioning and your online presence is that this can actually help to create a better work-life balance. So what's possible is to pre-qualify the patients you see in your consultations. So you actually spend more time serving the right patients. And that is, of course, a business decision you can make. You can position yourself so your content attracts the right patients, the ones that are really will benefit the most from your help, but also the patients you want to attract, serving a specific demographic and specific conditions or situations. So let me give you a few examples of brand positioning. The first impression the patient gets as they land on your website is crucial, because not only does it allow you to position the exact services that you offer, it's also an opportunity to add some more detail and to position yourself in a certain way, not just through the visuals, but also in the copy that you use around the visuals. And what we do is it's almost like a magazine article. It's a story. It invites the patient in to follow the story. So anyone in Brisbane looking for a tummy tuck will probably at some point land on Dr. Andrew Hadge's page and understand his personal vision, his recommendations, and his take on a tummy tuck. And that is where you can make a difference, not just making sure you're visible in a Google search, but also thinking about the conversions you want, pre-qualifying the patient leads who end up in your consultation suite, because that's where you make a difference. And remember, we're talking work-life balance. We're talking not wasting your time or the patient's time with a situation that's not ideal for your practice. Let's put it that way. So let's look at another example where this practice positions itself around country values. So if that resonates with you, there's a higher likelihood you will really love the practice. So if you land on the pages and you read up on the vision behind this practice, you get to know the obstetrician and the team even before you make a booking. That is, again, pre-qualification in action. It makes sure that if you don't like country values, well, you might not make a booking. This website here in Sydney, Dr. Anu Mahadig, again, does a great job in highlighting specific services that are important to the obstetrician, such as high-risk pregnancies, really focusing on the high-end expertise as an obstetrician, as a gynecologist, in the choice of pages that are available on the website. And remember, all individual pages have an important role in making you visible in Google and in making sure you rank really well for specific topics. But there's a second component when one of those super content pages informs the patient about your personal take on, in this case, antenatal care in Sydney. Something happens. There's a pre-qualification. There's a process where the patient starts making up their mind about whether you're a good match or there's going to be a good match between the patient and the specialist. So that is how your digital brand positioning influences your work-life balance and the quality of the patient leads you attract. If you want to learn more about this, just book a free one-on-one strategy session. We'll apply this to your niche, to your specialty, to your practice, and see how we can help you, obtain a better work-life balance as a doctor.